It's the Real News Network. I'm Sharmini Pires coming to you from Baltimore. In the United States, many sociologists would agree that the war on drugs and systemic issues on drug prohibition has been the most destructive, dysfunctional, and immoral policy since slavery and Jim Crow. In a recent study by the National Center on Addiction and Substance Abuse, reported that 2.3 million inmates crowding our nation's prison and jails, 85% were substance involved. In Switzerland, in the early 90s, there was a rising number of injection drug users, visibility of open drug scenes, the AIDS epidemic was taking over, and rising number of drug-related deaths. Poor physical health and high criminality were the conditions. The Swiss did something really unique. They didn't opt for incarceration of the people involved. Instead, they made a fundamental shift in approaching the problem caused by what they were dealing with at the time, heroin addiction. But most importantly, the Swiss offered the people treatment on demand using substitution drugs like methadone. Second, patients in Switzerland were allowed to stay in treatment centers as long as they wish, and they were offered treatment as long as they wanted. A variety of different treatments were available in order to treat a broad range of dependent people. Does that sound more civilized than locking people up for substance abuse? Well, our next guest, Howard Wooldridge, who is an 18-year veteran police officer and detective, thinks so. Since 2005, he has been the police voice in the U.S. Congress, opposing drug prohibition and promoting a 10th Amendment state rights approach to drug policy. Howard, good to have you with us.
It's a pleasure to be here.
So Howard, what is it that you have learned from going to Switzerland and studying the situation and their approach to drug addiction that you think is vitally important for us to learn from?
Well, the Swiss have been doing this now for 22 years. It's copied, their program is copied now in 7 other countries. And this is Switzerland. This is the land of practical people, rational, logical, and frugal. And that's why their program is so widely praised around Europe, because it does what we all want: to reduce death, disease, crime, and ultimately drug use and abuse. So it's highly successful, and the United States could certainly learn from it. And all of the portions of their program are easily implemented today in America in terms of, as you say, the treatment on demand, et cetera, without changing any laws. The only thing that makes them unique in being Swiss is that for a small percentage, 8% of their addicted population, they allow them access to legal government-issued heroin twice a day in special clinics in 24 cities, and in fact also in 2 prisons. You probably know that no American prison allows substitution treatment, which the Swiss said, why not? Because people in prison are also addicted to these things and need to get the treatment that every addicted person needs.
And what do we know about these policies and the impact it has had? How successful is it?
Well, most importantly, as we saw 47,000 die last year in America, the Swiss have lost 0. Not one person has died who's inside the program of a heroin overdose. That's because the heroin they receive is bought in the legal market, is checked by technicians, and each patient receives a certain dose, which they know is not going to kill. It's a maintenance dose, and it cannot kill you. And that's the part which is a bit controversial, but the other parts, of course, are also controversial. For example, they allow a patient to stay on substitution drugs forever. Now, most patients get off within 3 years, but there's still 20% of the patients who started 20 years ago are still receiving either methadone or heroin on a daily basis. And whereas American treatment often says, well, you must be clean after 6 months or 12 months or whatever, and then be out of the program. The Swiss say, no, it's like being an alcoholic or someone addicted to cigarettes. You're a lifelong addict, and people have relapses, and we've got to be able to approach it rationally, which is what the Swiss do.
Now, Howard, you have been providing a report to the U.S. Congress and lobbying with that report. How successful have you been in terms of garnering the ear of our lawmakers?
Short answer is 0.0. Despite the delivery to all 535 offices, both hand-delivered and electronically, not one congressional office and the White House, none of them came back with any type of correspondence to say, tell me more about this program, or to double check what I was passing out, despite the fact that the summary does include a statement that the report was approved for distribution by the Swiss government in Bern.
And when you say the report was approved by the Swiss government to be presented to Congress, what is your level of collaboration with them? And you also indicated that this is something you do annually. So you must have a lot of back and forth about it. Why are the Swiss interested in lobbying our Congress?
Well, they are not. The Swiss are simply cooperating with me to give the United States Congress or anyone in America the best information about the Swiss program, and they appreciate the fact that I check with them and have them look at all the facts, make sure that some things change from year to year. And so we make small changes every year. This has been going on since 2005 when I first came to Washington, D.C. And they recognize and are proud of their approach to heroin abuse. And if they can save lives, why not? And that's their attitude.
And Howard, why do you think there's such lack of interest on the part of our lawmakers about such a successful program and solution?
Well, because the Swiss program de-emphasizes law enforcement and de-emphasizes it's going to hurt a lot of treatment programs in America. I just read a Boston Globe report. Americans are spending $35 billion a year on treatment programs. And if we move to the Swiss model, some of these programs are going to be left by the wayside. And so therefore, there are going to be powerful groups in America who don't want to change the status quo, including law enforcement. The Swiss simply say, when you want treatment, you can come in day one and receive it, and no more locking people up, no more putting them in jail. And this is going to hurt prison guards unions, et cetera. So there's already built-in resistance to change in America. And in fact, I believe that's why not one member of Congress, nor the White House, has expressed any interest in finding best practice. We keep looking around America for best practice, but in fact, essentially the treatment programs in America are all about the same.
And I'm wondering whether the larger prison industrial complex has anything to do with it.
Absolutely. And we're seeing this already as since the last couple of years, and great numbers of white people are dying because of oxycodone, heroin, et cetera. The society is shifting to saying, oh my gosh, if you have a drug abuse problem, you should be given treatment at a clinic as opposed to be thrown in jail for 2-3 years. This is a fundamental shift in thinking for America, and I'm grateful to see it. And however, if we continue down that path of thinking about it being a medical issue and de-emphasize law enforcement, that means my profession is going to start losing part of the $82 billion we receive every year to fight this absolute failing effort in drug prohibition, war on drugs. So powerful groups are out there saying we don't want to go too far because then we're going to start losing big money.
All right, Howard, I thank you so much for joining us today and giving us this snippet of information that I think is very useful and a solution-oriented one. I wish we had more time to discuss it, so I hope you come back on and keep us updated in terms of your efforts in Congress and also what you're uncovering in the process. Thank you for joining us.
You're welcome. I am at your service.
And thank you for joining us on the Real News Network.